Hello, everyone. Today is a very special day for me. The upcoming interview is with a person who is extremely dear to me and someone who has guided me through depression, overthinking, and insomnia. The person is a great friend, a sweet human being, and moreover, an impactful BNYS doctor and a Garbha Sanskara coach. She is the founder of Matru Deva Bhava Garbha Sanskara. She has treated over 1,000 patients with lifestyle disorders through yoga and naturopathic principles. She has turned many complicated pregnancies into healthy ones. She has conducted 20 plus women's health awareness programs in various colleges and schools across India. And the list of her achievements is healthy and extremely long. So, with a loud virtual applause, please help me welcome Dr. Chandralekha.
Thank
Hi,
you. Thank you
Doc.
so much, Shubham.
Welcome to this
Thank
interview.
you.
So,
Thank
Doc,
you so much.
I'm really
Yeah.
excited for this. I've known you for like 11 months, and
Yes.
knowing you is a blessing for me. So, Doc, thank you so much for joining on a short notice. There were mess ups
Thank
earlier, but
you.
thank you so much for being kind and
Thank
patient.
you.
So,
Yeah.
Doc,
And also,
really excited. Yep.
yeah. Thank you so much for interviewing, like inviting me on your interview.
It's an honor. It's an honor, Doc. So, Doc, let's get into it. Doctor, the first question, and even I'm curious to know this: what is Garbha Sanskara?
So Garbha Sanskara is especially about the lifestyle what a pregnant mother has to follow, especially during her pregnancy. So this lifestyle includes everything from her waking up time till her like how she sleeps, how she wake up in, like it is a lifestyle completely about the 24 hours. How
Right.
she has to wake up, what kind of food she has to eat, what kind of thoughts she has to think. It is all about the like complete lifestyle of the mother,
Okay.
which directly affects the baby who is inside the womb also.
Understood. Understood. So, Doc, basically, for beginners like me, when we talk about Garbha Sanskara, what happens inside it and how does it help the pregnant woman and the unborn child?
Okay. The first thing is especially helps both mother and baby, but for mother we can avoid all such complications like many things like mother undergoes. It could be from early pregnancy to the later like third trimester also. Early
Right.
pregnancy mothers undergo like nausea, vomiting, headaches, fatigue, and so many other problems. So when mother undergoes Garbha Samskara, she can handle herself in a more better way. So she'll
Understood.
have that feeling of the joy of pregnancy. She can enjoy her pregnancy throughout the days. And for the baby, it is like the bliss. Like baby can understand many values and virtues right from the like from the initial days of pregnancy. Baby can understand all the emotions of the mother, and baby can also understand the best bonding between the parents and the baby. And also we can educate at the baby like from the very early days so that the baby gets a lot of intellectual knowledge, spiritual knowledge. It's not just about the knowledge, but also we can educate the baby. It could be from physical dimension. We are just covering all the dimensions like physical quotient, emotional quotient, intellectual, and the spiritual quotient. And what's the use if the baby is very intelligent and not so strong enough, right?
Hmm.
And what if the baby is very strong and doesn't have proper intellect? So it is all about balancing of all the four dimensions of health and the quotient where we can support the baby also as the mother.
Understood. So, while you were saying, you said the baby understands the mother in the womb. So,
Yes.
I've worked with this, so I know a concept called Garbh Samvada. So, tell us about
Yes.
it.
Garbha Samvada is a special concept where mother and the father, it's not just the mother,
Okay.
also father and the family members also talk to the baby. So directly we cannot see the baby, but we can feel the emotions, and baby also feels and understands the emotions. And whenever we talk, we have an interaction with the baby.
Right.
So how we can understand is when we talk to the baby, when you keep your hand on the womb, definitely baby can move according to the voice of the mother and
Hmm.
also to the father. That doesn't happen just in 1 or 2 days, but as in how the mother interacts with the baby on a regular basis, she starts to interact. She starts to tell the stories. It could be values. It could be songs. Anything when she
Mhm.
starts telling the baby every day, baby can understand those emotions and it can turn accordingly wherever she's keeping her hand and talking. The baby turns towards the mother's hand. So such
Yeah.
beautiful moments we can observe through Garbha Samvada.
Nice. And you mentioned the role of the father. So, in Garbh
Hmm.
Samskara in general, what is the role of the father? Because I've seen and I've also heard that during pregnancy, only women are told to take care of themselves, to be healthy
Hmm.
and to eat healthy, plus
Hmm.
keep track of their sleep. So, what is the role of the father in pregnancy?
Hmm. So role of the father is not just about taking of care of finance, but
Right.
also more than that,
Hmm.
father should start connecting with the baby. So people tell that once baby is born, then mother shows the father that he is your father, but that's not the concept. Here, whenever the father also starts connecting with the mother in with more deep in connection with love, compassion, and caring, the relation between father and the mother gets connected, and that is also a form of love, right? So baby
Right.
understands the connection between father and mother. This is the purest form of love. Then
Correct.
baby understands that's love, and also when father starts with Garbha Samvada, that is talking to the baby within the womb, then baby also can understand he is one person who cares me a lot, right?
Hmm.
Then that's how the bonding between the parents and also bonding between the child and the parents also is enriched. So
Right.
that's how the baby grows up, and he is very much lovable to the parents. So as we are seeing right now, they're like many children are growing up and becoming very hazardous with their parents, and they are
Hmm.
not taking care of their parents. And also many criminalities also, like the rate of criminality is also going high. So
Correct.
through Garbha Samvada, we can tell what is right, what is wrong, right from the birth. And why is this so much important is whenever we start talking to the baby, all of these values and virtues goes directly into the subconscious mind of the baby.
Hmm.
There are no such filters where it can understand whether it is good or bad. Whatever you
Correct.
give, whether you give good inputs, whether you give bad inputs, whatever inputs you give, it takes up. It's like just like a clear sponge. Whatever kind of water you give,
Hmm.
it just absorbs the same thing. That's how it works. So
Exactly.
when we give the best inputs to the baby, it can understand, okay, these are the things I have to do, like that. And it cannot be modified even once the baby grows up also. That's the biggest benefit of Garbha Sanskara and Garbha Samvada.
Nice. Nice.
Yeah.
So, regarding Garbh Samvada, pregnancy is a period when women go through stress, if I'm not wrong.
Mhm.
So,
Yes.
I also know that while working with you, you said affirmations also help. But I feel
Mm.
not only affirmations, yes, affirmations are crucial, but along with it, you have to feel what you say. But
Yeah.
okay, so for instance, I'm sitting like this and saying, I'm really happy today. I'm really
Mm.
happy. So so I have two questions regarding affirmations. First, if I'm sad from within and if I
Mm.
utter I am happy, does that work?
Mm.
First. And second, what is the role of emotions in affirmations?
Okay. Yeah, nice questions actually. See, whenever you're not feeling what you're telling, they are just words. It doesn't
Right.
have much effect on us. And
Hmm.
why we ask mothers and all, even in fact, for affirmation for anybody, for that matter,
Hmm.
when you feel what you're telling, for example, you feel I'm happy and you tell with happiness,
Hmm.
those emotions are carried through the blood. That means those emotions are linked with the hormones. When you're
Correct.
happy, your serotonin and your endorphins boost higher, right?
Right.
So
Right.
those emotions and those hormones are even going to the baby also.
Okay.
So there is no separate barrier for emotions between the mother and the baby. They are very intimate. If you're sad for one day, definitely those sadness on cortisol and stress hormones are reaching to the baby.
Right.
If the mother is very happy, or even and she has to feel what she's doing. So even it could be the values, whatever she has to follow, she has to tell baby, and also she has to start like implementing in her life.
Correct.
That's
Correct.
how the baby can connect with the mother and the father very deeply.
Correct. Correct. Understood. And yes, regarding the emotions, there are places where the home environment is not suitable for the baby. So there is
Hmm.
tension in the house. So when a pregnant mother goes through Garbh Samskara and especially Garbh
Hmm.
Samvada through affirmations and all, how
Hmm.
can she, since the environment is toxic, how can she make full use of affirmations and how can she change her emotions?
Okay. First thing is she has to analyze whether the environment in which she is living is whether
Mhm.
healthy or not. It's
Okay.
not just about the environment, whether about oxygen and all of that, but
Right.
what kind of people she is living with,
Hmm. Hmm.
whether they're toxic, whether they're disturbing her mentally, physically, and all of that. So she has to look into that. And family members also should be educated. So the
Hmm.
pregnancy is just not for the father and mother, but also it is to the entire family. Everybody should have that knowledge to support the pregnant mother, not to have smooth swings, and all of that. So these disturbance starts just from the mind and only then comes out, right? So
Right.
we all have to support the mother in such a way that she just don't get disturbed very easily.
Right, right,
That's
right.
how
Yeah,
the environment works.
correct, correct.
Yeah.
And yes, I have heard your environment is stronger than your willpower. So yes, no
Yes.
matter what you do, if you're in a toxic environment, nothing will work. So, but however,
Correct.
there are
Hmm.
places where you cannot change the environment. So in
Hmm.
that case, what could a couple do?
Hmm.
Because
Yeah.
what because people could, yes, people could go to parks, they could go
Hmm.
to some other peaceful places, but if they have no choice and they
Hmm.
cannot change the environment, then in that case, what could a pregnant woman do?
Yeah, this is a very, very nice question actually. See, what they can do is first thing they have to tell themselves that these tough situations are yet to come and they will come. So
Hmm.
one thing what they should be start following is they should make themselves more stronger first. That
Okay.
is one thing.
Hmm.
And along with that, they have to start accepting them as in how they are already. Some women, it could be mother-in-law, father-in-law, or
Hmm.
husband, or anybody else in the family, they
Right.
are toxic. They are
Correct.
not listening to them. They are not supporting them as they want. So what we have to do is we should start forgiving them. So forgiveness is greater thing what cannot affect themselves and the baby also. So
Right.
when we start understanding them as they are, we don't get depressed because not we are not keeping those kind of level of expectations with them
Hmm.
that make us more depressed.
Correct. Correct. Understood.
Yeah,
So
through
yeah.
affirmations and positive visualizations, we can overcome to all of that.
Right. So basically, what I've understood is, yes, you cannot change the environment. If you are in a
Hmm.
toxic environment, you cannot change it. But what you have control over is what is going on within.
Yes,
So,
exactly right.
so
Hmm.
when I talk about what goes on within, uh, there could be meditation.
Hmm.
Yoga is one thing. Pranayama is one
Yes.
thing. And when I say
Hmm.
yoga and pranayama, uh,
Hmm.
is pranayama and yoga, are these two ideal for pregnant women in their third trimester?
Awesome. Exactly. They are fine from, in fact, from second trimester, third trimester, and all the trimesters they can do.
Okay.
Yoga and pranayama they can do anyway, but yoga,
Okay.
what they have to look into is if they're not used to doing yoga or like it could be gym, weightlifting, anything
Hmm.
prior to the pregnancy,
Okay.
they should see whether they can do it or not. First, they have to go to the doctor, ask them whether they can do it or not. If they have any complications in their early pregnancy, like first, second, third month, they
Mm-hmm.
should look into it, take some rest. If that is okay for them, they should start doing. Many people have that notion that yoga is good for everybody can do it. It's
Hmm.
not that way.
Okay.
So, and always one thing what everybody should remember is yoga should always be done under some supervision. It
Okay.
could be yoga teacher, doctor, or some physiotherapist, whoever it is. It should be done under some supervision so that they don't do something in a wrong way and end up with some other problems. So
Understood.
that's one thing. And pranayama also the same thing. They have to do it in a very regulated manner
Mm-hmm.
and not do as in how they look into, not just looking into some YouTube video and doing it,
Mm.
but
Right.
doing under supervision will help them to correct them. And also, if they're doing something wrong, the person can guide them in a proper way. That is one thing. And
Okay.
coming to the benefits, it has enormous benefits right from early pregnancy. In fact, yoga should be started from pre-conception period so
Okay.
that completely body, mind, and the soul are getting completely ready for accepting the baby. That's how the mother, father, and the entire family and the baby who is going to come into the womb also will be ready for the conception. That's how.
Understood. Understood. Okay. So I've worked with you. I've been your student. We have done yoga together. So,
Yeah.
Doc, yes, you have been my yoga teacher, but
Hmm.
when did you start helping women? When did it come into your mind that I will start Garbha Sanskara?
Yeah, it was in my internship. My last after fourth year, we started internship.
Okay.
At that time, I saw many women who are suffering with menopause,
Mhm.
right from puberty, like 14, 15 years. Many girls used to start their menarche, and that time they used to go through many problems in their menstruation and all other things. And in the age of fertility, many women used to get infertility. They had many issues with conceiving, and also pregnant women used to have a lot of complications, especially when they come to third trimester. They
Mhm.
used to have a lot of back pain, placenta previa, and so many complications they used to undergo. That's when I felt I should do something for especially women. So being myself as a woman, I thought of empowering women through money, education, and all of that. So since I'm into a health and wellness reach, I thought with whatever skills I have, I should start helping them so that they should come out of all the health complication what they have right now. And along with that, later we can help in all the other dimensions of life also. So
Right.
that's how, and I myself have seen many mothers felt very bad when they lost their pregnancy, when they had sudden miscarriages, and they broke in like anything that they felt it is waste of living. That's how they felt. And it was very difficult for them to conceive again also. This had enormous effect on themselves. Many women underwent so much of depression in their life. So, and I have even seen many families like they're praying for God for getting a divine child, which is not happening. And this also being a major problem in the society today also. That's how I was inspired to learn something great in life so that I can help majority of women and also those pregnant women. And I chose Garbha Sanskara in specific because I'm a naturopathy doctor, I treat many lifestyle disorders. It could be diabetes, hypertension, asthma, like all of these conditions. Majority they are from lifestyle based disorders. So many of them used to be above 50 years, 40 years of age, and they used to come with chronic disorders. They used to have these problems since 30 years, 20 years. Some for some corporate individuals, it could be like a lifestyle disorder. And later on, for children, why did I think it was through Garbha Sanskara, we can prevent all such lifestyle disorders right from the womb itself. This is one of the biggest advantage anybody can have, right? So you can design your baby not to have any of diabetes. Right now, what we are giving to our babies is all about the stressful life, diabetes, and all other harmful thoughts to the baby. So through
Correct.
Garbha Sanskara, we can put a big filter on this so that we can not pass all our karmic issues to our baby, and also we can prevent all such complications what we have to our baby.
Right. Okay. So you have mentioned quite a few challenges there that women go through. But in your experience, what were the top
Hmm.
three challenges faced by your patient and the top three challenges faced by you while training and coaching them?
Okay, so challenges by pregnant woman or other woman?
By pregnant women. And okay, you can answer both women who were trying to conceive and women who
Mhm.
were pregnant.
Okay,
Hmm.
women who were trying for conception was one such thing was the stress thing.
Okay.
So they women especially have a lot of challenge with their profession, home, husband,
Hmm.
and other financial things. So many things in their life
Exactly.
that they give least priority to themselves. So which is
Hmm.
affecting them also and their family also, which they are not understanding in prior.
Hmm.
So once they undergo a lot of struggle for conception and then it doesn't work, and they have to work a lot on it.
Right.
And also women are like something, they don't care for themselves. They take care of their family, children, in-laws, everything, but they don't focus on their health. So what I was thinking was, if I start training women to take care of themselves, they'll be in a better manner to take care of the entire family, right? That
Right.
is one advantage of that. And other challenges could be, yeah, one is the stress, and other thing was the lifestyle. Because of not having much time, they never
Hmm.
had the sufficient time to cook in their home, to have their
Hmm.
that positive conversation with their loved ones. They didn't had some time to go for a fresh air walk.
Okay.
So they were not able to follow lifestyle because of the extremely busy schedule in their life. So I thought of teaching them the proper lifestyle so that they can follow in whatever time they can have. And they were not, the third challenge was the not having proper priority in their life.
Oh.
Some were always busy with their financial problems, some were always busy with their relationship problems, and some people didn't have a proper clarity on what to think actually. So
Right.
these were the top three challenges of the women, those who were supposed to get conceived. And for pregnant women, the first thing was all the ailments, especially during pregnancy.
Hmm.
So many used to come with fatigue, backache, nausea,
These
vomiting,
are the major challenges during pregnancy, right?
challenges.
Yes.
Yeah. So they were not able to handle themselves. So they used to have a lot of mood swings because of this.
Okay.
And this was the first thing. Second was about the food and nutrition. So early in pregnancy, they should follow, not just in early, but all the trimesters, they have to follow better nutrition to have the best child.
Right.
It could be the brain development part or the physical development part, all of that. So when they start taking care of the baby, definitely we can prevent 90 to 95% of nutritional deficiencies right from pregnancy. So this
Okay.
was one thing. Another thing was the stress again in pregnancy. They had a lot of doubts what to follow, what not to follow, because women have, like, they'll be getting lots of tips from everybody, from
Mhm.
in-laws, from husband,
Mhm.
from
Exactly. And they
doctor,
used to
from
get confused what to do and what not to do.
yes,
Right. Yes.
yeah. And another problem is Googling everything. They'll start
Huh.
searching in Google, and they'll end up with a lot of things, and like information overload will be there. And
Exactly.
with that, they don't know what to follow exactly, what not to follow.
Mm.
And they don't follow anything. Either follow too many things and end up with confusion. So that's why I thought, okay, let me tell them what to do exactly and what week. For example, in their 17th week, what
Mhm.
kind of diet should they have,
Okay.
and what kind of music they have to listen, and what kind of thoughts they have to do, and what kind of activities they should do. If we are giving proper instructions to them, pregnancy is a very, very joyful experience for them in their entire life.
Right. Right. Yes, because what I've heard is pregnancy is a very painful journey. So
Yes,
when I
it's
came across
not.
Garbha Sanskara, when I learned from you that pregnancy can be enjoyable, it could
Yes.
be a blessing, it could be blissful. Then it made me wonder how it is. But when I worked with you, when
Hmm.
I went through your courses, I understood that yes, it is possible. So these challenges that women face,
Hmm.
how can they overcome them? I'm not saying they will overcome them, but how can what things they can do that the pregnancy journey becomes joyful.
Hmm. So you're asking about the challenges.
No, they go through certain challenges, but what they can do to make the journey of pregnancy joyful.
Okay, okay.
Yeah.
So first thing is they have to start educating themselves what is
Mm.
going through them.
Mhm.
First thing is that. So they should understand what are the symptoms they will undergo in the first trimester. What kind of development is their baby going through? What
Mhm.
changes will she see in her own body?
Right.
So
Okay.
pregnancy, there is a lot of weight gain. There is a lot of shape is going out of that, and many women are getting depressed because they are gaining weight, which is very normal in pregnancy. And also they
Mhm.
should know how much weight should be gained in what trimester, right? So
Mhm.
not knowing anything can put on lot of confusion to them. That's why
Yeah.
in my courses also I tell, in fact, everything in detail. I take separate sessions for them, clarity sessions on what is happening with them first. Only
Okay.
then we can give the right suggestion to them. And
Correct.
all these suggestions are just not for the pregnant woman, but also to the husband of them, so
Mm.
that they can support them well. If they're
Correct.
not going, if they're not understanding why mood swings are coming and they also react the same way, if
Mm.
nothing is going to work,
Exactly.
right?
Exactly.
That's how it is important for all the couples to understand about pregnancy in detail, and also they can understand and tell each others also. They can support other couples also. That's how we
Mhm.
can, in fact, together like improve the society and understanding about pregnancy.
Exactly. Because yes, there although in planned pregnancies, people are not aware what will happen
Yes.
when. So yes, you raised a great point there. Awareness is crucial. If
Hmm.
people are aware, they will help other couples. So for
Exactly.
spreading awareness, your course
Hmm.
is one great platform, and your coaching is, I think, the most phenomenal coaching out there for Garbh Sanskara and pregnant women.
Yeah.
So, uh, regarding Garbh Sanskara, doctor, when
Hmm.
can people begin Garbh Sanskara?
Okay. There are actually three things. First is Garbhadan. Garbhadan is something where we start giving Garbhadan in pre-conception period. That means before conception.
Okay.
It could, like, they can start before 1 year, which is very
Mhm.
good plan.
Okay.
If they're not planning for 1 year, at least they should go through 3 months. So 3 months is a very basic period, because at this time the kind of ovum which is formed and the which is kind of sperm which are formed are very
Mhm.
much purified,
Okay.
and mentally, physically, and also spiritually, these uh, ovum and the sperm also getting ready for conception. That's the deep level of Garbhadan. So
Okay.
we also have some vidhan, how to follow, and all of that, the purifying systems, everything that comes in the preconception, that is Garbhadan.
Okay.
And Garbha Samskara starts exactly when the woman gets conceived.
Mhm.
So from then till delivery, the last day of delivery,
Mhm.
Garbha Samskara goes on. And once the baby is born, then we give Bala Samskara. That is, all those things which are taught to the baby, and also taught to the mother how to handle the baby. During Garbha Sanskara, we teach them the kind of lifestyle they have to live, kind of prayers they have to do, and what kind of food to follow, what are the do's and don'ts, and changes, Garbha Samvada, and there are so many things like journaling is there, affirmations, visualizations,
Mm-hmm.
and so many. Actually, there are specific activities for the brain development of the baby also. We have two like brain, left brain and the right brain.
Right.
So for this, we have specific activities to improve the memory, concentration, focus, and so many different. We have specific activities or specific things. In fact, you can design your baby as a designer baby. We have designer clothes, designer house, right? The same thing. We also have a designer baby concept, especially in Garbha Sanskara.
Okay, so this is a new concept for me. Explain how it works.
Yeah, see, for example, you want your baby to become singer.
Okay.
Then you can inspire your baby by listening to a lot of songs from a specific singer, in fact, or you can start giving education on specific ragas, talas, and specific kind of music. It's not that I am giving the proper direction to only go to in one direction. It could be singing or dancing or anything like that. Not choosing the niche of the baby right now. You can introduce all of them. But the major things, what we can see from many of the examples and research papers is, there we can see that whatever inputs we are giving now, like in pregnancy, are there forever in the baby's brain and the mind also. That's how it works.
Okay. So, Doc, for people like me who are new to this, and people who want changes in themselves and their babies, does Garbha Sanskara help them?
Definitely works. And in fact, you yourself can transform first, and then you can transform the baby. What everybody thinks is, if I follow Garbha Sanskara, I'll get a child however I want. That's not true. You should start inculcating those qualities, what all you want in your child first in yourself. Only then you can give it to the baby. If you don't have, you cannot give. That is one thing. So that's how even while designing the baby also, we have to analyze those qualities, whether we have it or not. If you don't have it, nevertheless, you can start inculcating or implementing those things first. Only then you can teach your baby also.
Exactly. So first we'll have to learn, and then we'll pass it on to the babies.
Exactly right.
Okay. So, Doc, for someone like me who wants to make certain changes, I've been an insomniac, I've been an overthinker. So, does Garbha Sanskara or Garbha Samvada help me?
Definitely, it helps you.
Okay. Because I read a report that about 89 to 90% of the people are depressed. I'm not sure if that report is correct, but 80 to 90% of the people are going through depression. So, does Garbha Sanskara help them? Anything in particular that helps them? Is it Garbha Samvada, affirmations, visualization? What is it?
Are you asking about depression to the baby or yourself?
Depression to people who are not sure about Garbha Sanskara, but understand that Garbha Sanskara could help them overcome depression.
Definitely it helps, because Garbha Sanskara is not to the baby just. It is an entire personality development to both the parents and also to the baby. So once a couple undergoes Garbha Sanskara, they themselves get transformed into a positive lifestyle. So they understand what is their personality and how a baby should be there. Everything they will understand. And whatever is deficient in them, they will understand. Then they can implement those things to improve themselves. That's how it works.
Understood. Okay. So, Doc, you have helped more than over 1,000 people. So, what has been your one remarkable moment or one remarkable milestone in this Garbha Sanskara coaching journey?
Okay. So, you're asking about the cases?
Yes, your most remarkable case study.
Okay. Okay. I helped one pregnant mother. She became pregnant in her 40th year. And her first child was 11 years old when she conceived. So this was a very challenging pregnancy. She was in a very confusion state whether to continue pregnancy or not. So she thought of continuing it, and she was very weak because her age was 41 years when she was pregnant, and she was also undergoing so many challenges. She had anemia, very less hemoglobin. She had a lot of back pain, and all other issues also were there. And doctors also told that her baby might get Down syndrome because her age is higher.
Okay.
And she also had many problems with her family, emotions, and so many other mess in her life. So she's a botany lecturer in a college here, in a PU
Okay.
college.
Okay.
So I met her once, then I told about this. Then she did not believe, actually. Initially she didn't understand about Garbha Sanskara, but I fell behind her, calling every day, you have to follow this, you have to follow this. And she finally joined. She used to come to yoga classes, she used to start doing. 1 or 2 days she used to come and she was dropping because of her emotional imbalances. Then later on, I was insisting her to follow Garbha Samvada to the baby, and baby used to react to her very well. Then that's when she felt that miracle. No, I have to follow this, only then I can feel the good results. She had very low hemoglobin, it was around 7 or 8. She had to undergo so many medication, and also doctor insisted her to take blood transfusion also because her HB was very low.
Okay.
Then I started giving her proper nutrition and diet to improve her hemoglobin. Then that also came up just in 15-20 days. I was surprised to see this.
Wow.
So that was one thing. And she had severe backache because her age was little higher. She was not able to balance herself properly. After doing yoga, she had a lot of transformation in herself. Her personality also got improved.
Wow.
And even family members also, she started reacting with more positivity in herself. So that's how. And later on, her EDD was given on May 3rd, but she delivered on May 30th, April 30th itself. And that too, her labor duration was very short. And she herself told that the first pregnancy took about 2 nights and 1 day, which is very longer labor.
Wow.
Usually the first labor takes about it could be from 12 to 14 hours, but the first labor took her about 2 nights and 1 day. It was very long and very painful for her. This time it just everything got over in just 6 hours. This I was not able to believe that just got over in 6 hours.
And that too a healthy and a normal delivery at the age of 40, 41.
Exactly.
Wow.
And baby was so cute that recently
Yes, I
even
saw
went
the
and
video. Extremely happy, extremely joyful and a lively child. Yes.
And recently we even started Annaprashana Samskara. Which is one of the 16 samskaras.
Okay.
Where we start weaning the baby. After 6 months, we also give supplements, the nutritional supplements and the food to the baby. That's which is to be celebrated, which is very good one. And this is how we take the Vedic culture into our current lifestyle, because which has been forgotten for so many ages. Now we want to bring that Indian science again back to India, giving more awareness to the people, understanding it better way. And if we start implementing, I think the day is no more away. We can again feel the golden age coming towards us.
Exactly. It will be doctors like you. I'm sure the golden age is imminent. So, Doc, you started Garbha Sanskara. So, what is that why? What is your mission of starting Garbha Sanskara, and where do you see Garbha Sanskara in 10 years?
Yeah, my mission is to help 1 million mothers have happy, healthy, and intelligent children to this world, to transform the entire society. Because now we are seeing lots of problem. It could be the financial problem, social problem, ethical problem, and so many kind of direction we are not even able to assess where it is going. So through very like healthy children, we can first implement that healthy society, and with that we can also help entire society about taking more positivity inside. And I want to see Garbha Sanskara in 10 years where every child supports each other. We even include education system in Garbha Sanskara.
Right.
Yes.
Okay.
So where each and every mother can help each other in understanding about Garbha Sanskara. Children also have very much intellect and they can understand even parents at any age. So people think that children have to grow up and then they should start understanding their children. Now children of 5-6 years can understand their parents very well. In fact, they can understand the problems also. So that's how when the emotions get connected, right? So that's how. And also nowadays children are also getting more addicted to all. It could be the technology like phone and all of that. Now through Garbha Samskara, we can give them sufficient time to explore the proper things at proper time.
Right. So, Doc, you have helped over 1,000 people Your mission is to help 1 million mothers, which is a noble reason to start this. So, Doc, before we end, what is your one message to the world regarding Garbha Sanskara?
One message to the world is, first they should respect their pregnancy, know the importance of motherhood, start enjoying your pregnancy, just not cursing anybody for your pregnancy. Pregnancy is one such joyful moment in a world where you can only experience. People can just see you or help you be happy, that's all. But you are the one person who is
Sorry.
completely responsible for your baby and your family. A child for a family is a divine blessing, and also it is the biggest contribution to the society as well. So
Right.
when you are giving such a wonderful intelligent child to the society also can develop in itself, right? So that's
Correct.
one major mission I have, the vision I have towards Garbha Sanskara. That's why I chose this.
Great. So, yes, you are the parents, you bring the child into the world. So, it's your responsibility to inculcate the traditions and the sanskaras through Garbha Sanskara. So, awesome, Doc. That's about this interview. I'm sure all of us will learn many new things today. I'm really mind blown with all that you shared. And yes, Doctor, I will be bothering you to learn more about Garbha Sanskara.
No problem.
Thank you so much, Doc. Thank you so much. So, all the people who are watching on Facebook or
Thank
YouTube,
you.
if you want to connect with Dr. Chandralekha, I've placed the link to her profiles and community below the video in the description box. So, thank you so much, Doc. I look forward to learning more from you. Before we
Yeah.
end, let's click a snap
Thank
together.
you. Sure.
Great. Thank you so much, Doc. Thank you so much for your time. I'm really honored, and all the best to you.
Thank you. Thank you so much for giving this opportunity and like, completely giving this awareness to you and the world also. Thank you so much.
Thank you so
Lots of
much, Doc. We are
gratitude.
honored. Thank you so
Yeah.
much.
Thank you.
Thank you. Have a great day, Doc. Thank you. Bye-bye.
Thank you.